In this video, we will discuss how to tape an ankle sprain. The purpose of taping. There are many reasons one might tape a joint. To prevent re-injury and facilitate early return to play. To support the joints and muscle and tendon units by limiting excessive or abnormal movement. And to enhance proprioceptive feedback. General taping technique. You should apply the tape at least 20 to 30 minutes before activity. This gives time for the tape to adhere better. Always start and end laying the tape without tension. Generally, always tape from distal to proximal. There are three main types of ankle sprains: excessive inversion injury, excessive eversion injury, and the high ankle sprain. Eversion injuries are less common because of the strong deltoid ligament complex. High ankle sprains are more severe but also uncommon, and the injury is caused by forced dorsiflexion and external rotation. The inversion sprain is therefore by far the most common injury and will be the focus of this video. There are many variations out there on how to tape the ankle, but they all involve some variation of anchoring, stirrups plus or minus spurs or horseshoes, heel locks, or the more fancy figure 8 heel lock, and finally, a figure 8. The ankle should be positioned at 90 degrees with the heel off the ground. Step 1. The anchoring strips. Place 2 anchoring strips on the distal leg just before the calcaneal tendon meets the gastrocnemius muscle. Then place 2 anchoring strips at the proximal foot. You should aim to place these as proximal as possible. And make sure there is little to no tension because the body weight will cause the foot to spread out, which can make these anchors uncomfortable. Step 2. The stirrups and spurs. Lay down 3 alternating strips of stirrups and spurs. Pull from the medial side to the lateral side. Try to create a little more tension on the lateral side. Think about reversing the injury. The stirrup should remain tight along the heel, but splay out at the top. Step 3. Enclose the leg and foot to ensure no skin is visible. Step 4. Heel locks. Note that heel locks can be done in separate pieces or in succession. Start with the lateral heel lock. Place a piece of tape on the medial aspect of the foot. Loop it around the ankle, starting at the front and coming around the back. And then trace the tape back up to where you started. You can do this once more for extra support. Now, place the medial heel lock. Start on the lateral aspect of the foot, loop it around the ankle, this time from back to front, and continue to meet back up where you started. Step 5. Figure 8. Start on the lateral aspect of the foot, looping it around the midfoot and meeting where you started, and then looping around the ankle and meeting where you started. This is done 1 or 2 times. The X of the figure 8 occurs at the front of the ankle. General ankle sprain management includes resting the injured ankle for approximately 72 hours, protect it if necessary to avoid re-injury, like for example high ankle shoes or taping, and then apply ice, compression, and elevation to help reduce the swelling and pain.